So just to give you some context, this is some photos from the airplane. On the left, you can see Abuja. It's a big sprawling city, lots of roads, lots of houses. And then as you fly to the northwest, you can see that it gets a lot more spacious. There's one main road and houses are very spread out. There's some that are really close to the road, and then there's other ones that are off dirt roads way in the distance. This is a picture somewhere in the middle between Abuja and Sokoto State, likely probably either Niger State or Zamfara State, which is actually where I was based for the last year. And again, you can see here it's dry season compared to the last picture where it was rainy season. So it's very dusty, it's in the Sahel. And there's, little houses everywhere. You can see there's on the right, there's a building with a blue roof. That's probably a primary school. This is a picture from the road. Once we got to Sokoto State, we would drive then down to our state, Zamfara, by car. And so you can see here, there's a picture of a little boy with his goats and his sheep. There's two primary ethnic groups that are in the Northwest, and they're in a bit of tension with one another. You have the Fulani people who are herders. They're nomadic, and they get closer to the cities as they're looking for green pastures for their animals. And then you also have Hausa people who are more farmers and they're more settled. They are expanding as well at the city borders as population increases as well. So there's tension for resources of land, among other things. This is another picture from the road of a more Hausa settlement. You can see that a lot of the houses, they have these big walls around them. They're usually compounds with multiple families living inside. So you'll have a husband with multiple wives, and then maybe they'll have adjoining space for their elderly relatives to live. And then that thing in the center, the circle thing, is where the grain storage is. So as the tensions arise within the Northwest, you have a lot of people coming into Anka City to seek safety. So here we have a picture from the end of 2019. Just as more people were coming in, they were all going to one primary location of displaced people, and you can see the shelters behind. This is from an event where we were doing health promotion messaging on World Hand Washing Day about the importance of sanitation and hygiene. And so MSF actually in the Northwest is the only organization that's working on the ground. You have many organizations in the Northeast dealing with the crisis there, but in the Northwest, it was really just our organization. So we were primarily focused, as usual, on healthcare. We had a primary healthcare center in this camp. We had an agreement with the government health facility in order to pay the bills, the medical bills of pregnant women who were going for ANC care or for safe delivery in the clinic. And we were also doing a lot of vaccination for the children under 5. In addition to the medical activities that we were doing, we had a lot of things going on with shelter, water, sanitation, and hygiene, distribution of non-food items, and especially most importantly, I think, is the advocacy we were doing both to the government as well as to other organizations, saying that there's a growing population of displaced people here and they need support for food support, for additional shelters, education, protection, every basic human need. Here is a picture of a settlement of Fulani people. You can see the little huts that are made there. And those are totally portable. So you would have a completely empty field one day, and the next day you can have houses pop up. And as the tension remains, these villages are growing. They're just on the outskirts of town, and they get bigger day by day. And it's interesting because you'll see that way in the back, there's a building that looks like it just has the walls up. There's no roof or anything. And so often you'll find there's just so many people coming into the town for safety and looking for shelter. So they'll be taking land and space where people are building already. And there's different agreements between the people that own the land, or maybe it's somebody who lives outside of the state, so they're okay with it, or it's even an abandoned area. So the way that we work on the ground, we have a lot of collaboration with the local community leaders. These are leaders from 2 different communities that were occupying a school building that had been abandoned, and the classes were only going on in a couple of the school rooms. And so we were working directly with community leaders to map out who was there. So we relied very heavily on the local leaders that we worked with, as well as our own national staff that was working on the ground and living in the community, to understand where people are coming. Because, as you know, we have to plan for our resources. We have to know how many people are here, where they are, where they're staying, what are their ages, so that we know what kind of services they're going to need medically, and how we can support them if there's any specific needs, especially in terms of disability. And then we can make advocacy as well for services that we're not able to provide. So with the maps that we make with the local leaders, we can then take them, and this is a screenshot of from Google Maps of the satellite from within our town. And this picture, I'm telling you, this is a very old picture, because although it's what you'll see today, there's a lot of additional buildings that have gone up in this area, and it's not super representative, but it's something, because we need to be able to map out. There's no central location of where the displaced people are living. And so we have to map out and know exactly where they are, so that we can make sure that if we're coordinating within our teams, within the water and sanitation team, or maybe the logistics team, that they know where they're going, because some of these places have 5 or 6 different names. And so we have to make sure that the drivers and the people going there know that we're all talking about the same place. And that also is a part of dignity for the people themselves. If they make a request to us or they need support in something, we want to be able to respond as quickly as we can. So another important factor about having accurate information and data about where people are staying and their ages and their needs is that we can respond to outbreaks of disease. This is a picture from one of the measles vaccine campaigns that we did. At the start of this year, we noticed in many of the camps there were outbreaks, and it's a very few number of kids having measles to be considered an outbreak in a displaced population, because people are living so close together. Diseases spread very rapidly, so we have to mobilize very quickly. And during COVID, it was a huge challenge, because what we would have usually have done would have been having a vaccine campaign in one centralized location and mobilizing all of the people from around town to come to that location. And because of COVID, we didn't want to create huge crowds. And so what we needed to do to act fast is we went around and we did more of a mobile clinic. So we were in each location just for a few hours. And this required so much coordination among the health promotion team, making sure that people were aware of this, that this was going to be in their location for this amount of time, because people go out and they go farming or they go selling or something. So they needed to know that we were going to be there at that time. And then also the community leaders to really encourage the people about the importance of vaccination. And it also helps us to make plans for those non-food items I mentioned that we distribute. So usually this is not something that we would do, but because there was nobody doing this, we had to. And so when new people would come into the camps, they would usually come in with nothing except for their children and maybe a few pots and pans or clothing items. So we would do distributions of new arrivals for buckets for washing. We had jerry cans for carrying water. We had mats to sleep on, as well as some soaps. And as well as for blankets for distribution during the cold season. It gets very, very cold at night during the cold season. And we learned that people were making fires in their plastic shelters or bringing in hot coals to keep their children warm at night. And obviously that's very dangerous. We were seeing quite a few burns in the facility. And so we decided we needed to do a blanket distribution as well. So knowing where the people were, how many people were there, all very important and relevant.